Cosmetic surgery is something most people associate with film stars and celebrities. The reality, however, is quite different. People from all walks of life are getting nips and tucks done to look and feel their best. These include students, politicians, homemakers, and professionals. So today let's find out what are the kind of treatments most Indians are seeking, what is the kind of change they want to look and feel their best. I'm at Apollo Cosmetic Clinic at Indraprastha Apollo Hospital in New Delhi. I'm here with Dr. Shaheen, who's going to tell us what makes cosmetic surgery so popular. What are the kind of people who come to you seeking surgery?
The people who come to us are from the average person, average housewife, to the college student, and the little old lady who wants to look younger and have less wrinkles on her face. So that's the spread. I mean, the men and women, the man component is about 20 to 25%. So every out of say 4 patients, 1 person would be a man.
So what is the age group where people seek?
They start out at about 19 and 18, 19, depending on the problem, and goes up to 75 when you talk about facelifts, surgical facelifts.
It's interesting that you use the word problem, because a lot of people say that cosmetic surgery is an elective procedure, and they think it's just a vanity thing and it's not really a problem. So do you think it's a problem? Do you think?
It's all about how you feel. And for me, I have this, my favorite story is, there was this lovely old lady. She was about 75 when she consulted me. This was about 15 years ago, 20 years ago. And she said, "Doc, it's been, more than 40 years I've been dreaming of getting a tummy tuck." I said, "Look, lady, you're 75 years old. Why? If there's a complication or problem, I'll have to justify, doing something like this to you." She said, "Doc, I'm going to be fine." I operated her. She walked away 2 days after the procedure, absolutely fine. And we met very often after that, and she said, "See, Doc, I'm still here." So it's not about, it's a problem. I mean, if I have a loose hanging tummy, or I have, a loose hanging neck, for me it's a problem. It may not be a problem for the person's son or husband or wife.
It makes you unhappy.
It makes you unhappy, just get it corrected. I mean, an 18-year-old boy, if he spent 4 years in school being made fun of because he's got breasts, gynecomastia we call it. And it's been playing on his mind. And now he comes with his parents, and his parents bring him and say, "Look, we need this operation done." And it's a fairly common problem in young men, gynecomastia. It's a 1-hour operation. The problem is fixed. The guy is a completely different person, once we do it. So yeah.
Which are the top 5 procedures or surgeries that women seek, and which are the top 5 for men? Are they different?
Not really. The top procedure for men and women is removal of fat by any liposuction. We have nowadays a newfangled device. It's called a Vaser, a liposuction device, where it's an ultrasound-based system where we first pulverize, break up the fat into little particles, and then suck it out. The advantage with this machine is that we can suck large volumes of fat, up to 12 liters, 15 liters
of fat. Oh, that's a lot.
In one go.
Earlier it used to be about 5 to
3,
6.
4, 5 liters max. But now you can go 15 liters, without, ending up getting a blood transfusion or complications. So that's the number 1 procedure for men and women.
So that would about, let's say if you're talking about 15 liters, how much? That would be about 15 kilos?
No. You don't measure that in kilos. Fat doesn't weigh a lot. But it's more about shaping the body. And in men with this Vaser, we do these, high definition Vaser liposuctions where we can actually create 6-packs. Yeah. So you don't need to go.
So do you get a lot of people who want 6-packs?
Yes, we do. We do quite a few of them.
Are they young, or are they 75-year-old men wanting to look like Sean Connery?
They are young. They are young, 30-year-olds, 25-year-olds who've been gymming away. And they need that little bit, that last mile, thing. and we can do them. Yeah, we even produce these,
Biceps and
the
triceps.
biceps
the
cut, triceps cuts, and stuff like that. So yes, we've got these very good high definition equipment.
So you said number one is
It's fat removal by any method,
Sure.
by liposuction in women, by liposuction or by tummy tucks.
Sure.
That's number one thing we do. In women, the other very common procedure is a lot of breast work. So there are large breasts which need to be made smaller. There are sagging breasts which needs to be shaped. And then there are small breasts that need to be enlarged. In India, we do see a lot of breast reduction work. Augmentation, there's been so much of PR about breast implants and causing cancers and causing tumors and that kind of stuff. So women are a bit spooked in India.
Is it true these, you call them rumors? So are they?
No, there is no fear of breast, there's no risk of breast cancer. But there are certain type of lymphomas which have been associated directly with don't want to scare everyone, but it's a medical fact. We do a lot of non-surgical work. So we're talking, Botox, fillers in the cheeks, lip fillers. Then there's a lot of non-surgical skin tightening of the face and neck by a procedure called Altera. It's a one-time treatment. It's a great thing. We get very good results.
This is the walk-away facelift.
This is the walk-away, yeah. This is you come and you go. And
how expensive is it?
It's about 150,000 rupees.
Okay.
And it's a one-time treatment. Effects last for about 2 years.
So it makes what? People look 5 years younger, 10 years younger?
Well, if let's put it this way, if I've been using this device now for 10 years, and you should see some of these ladies who have been treating, then if you see their pictures, they look pretty much the same what they looked 10 years ago. So it's a pretty good device, yeah. It does well.
You said ladies, so do you use it on men as
well?
well?
Oh yes. The Altera treatment is a 50-50 split between men and women.
Okay, that's interesting.
Then we have something called Cool Sculpt, the fat freezing device, again fat reduction. It's again a non-surgical thing which is pretty popular. We have to choose the patient wisely though. You get very good results with that stuff. And in terms of surgeries, then we talk, the nose jobs, which are relatively
These are more correctional surgeries.
Yes, people have big humps like mine, for example. People have, if a woman has a hump like this, obviously she's not going to be a happy girl. So we can fix those kind of things.
So what are the risks involved? Because how do people choose a surgeon, or how do they choose where to go to? Because now you have these kind of clinics all over the place, in small towns, even in villages I've seen boards saying cosmetic surgeon.
Caution. So let me use this platform to caution people. Of course, there is word of mouth, which is very important, and you can pick your doctor with references from other people who've had procedures. But if you don't know anybody, it's not like we don't have a system in India where you can actually search for officially go to the Indian Association of Aesthetic Surgeons and find.
There's so much misinformation.
Yeah, there's a lot of misinformation out there. What I would do is I would just choose my hospital. Because if I choose my hospital, a rather large healthcare facility, say like the Apollos or the Maxes or the Fortises or whatever, the Medantas of this world in Delhi, the kind of doctors that they would have, because they are JCI accredited and they have all the various accreditations and they are responsible organizations, they would have good doctors working in their hospitals. All operations are serious. There's nothing like a non-serious operation. Just a simple act of putting a patient to sleep and waking a patient up for me, is more risky than the operation. You need to be in a large healthcare facility for any surgical procedure, because stuff happens. And when stuff happens in a large facility, you're one phone call away from getting help of every discipline available in that hospital. But if you go to a small clinic, it's the luck of the draw. You may walk away fine, but you may end up in trouble.
Thank you. Yeah. Thank you so much.
You're welcome.